Hi everyone, it's Mr. Wright here. I'm going to talk you through our options guide for health and social care. Health and social care is delivered by the PE team and it's part of the options process. It's one of the options you can choose and it's a really good option for a lot of our students. The options process works just the same for this subject as any other. So we have our options fair on the 20th of January, subject information is released on the 23rd, subject taste sessions on the 25th, and I hope to see lots of you there getting a bit more of an in-depth feel for what health and social care is about. And finally, on Sunday the 19th of February, it's the deadline for submitting your options choices. So health and social care is the study of all different aspects of the healthcare system and the social care system within the UK. We look at different careers, different settings that health and social care is provided in, and we work to understand how that works and how that supports people in different stages of life. So we work all the way through from babies all the way through to end of life. So it's a really, really varied, really wide-ranging course that has a huge number of topics within it. Some of the things that we focus on within health and social care are things like communication and working in teams with individuals within health and social care settings. So this involves how you use body language, how you use verbal skills, how you use listening skills to get your point across or to understand the needs of people within the health and social care system. And this can be anything from nursery children to older people in a care home. We look at how the body works and different disorders that affect the body. So we look at a little bit of disease and how that's treated. We look at nutrition and how nutrition is needed for good health and how people in the health and social care industry can help to maintain people's health through supporting good nutrition. And we also look at health promotion campaigns, how the government and how the NHS and how different health and social care organisations use campaigns to try and improve the health of people around the country. The course itself is broken up into two parts. We do coursework and we do an exam. The coursework is done in years 9, 10 and the start of year 11, and then we move on to the exam. The exam's 70 marks. It's an hour and 15 minutes long and can only be taken at the end of year 11. It's a really good structure to the course because the students get to learn a lot about health and social care before we move on to the exam topics. And the exam itself is on the essential values of care, and that has lots of stuff around the legal requirements of health and social care, but also things linked into communication and how to provide good health and social care for different types of people. The coursework itself is mainly computer based, but there are some practical elements within that where students have to either present or use verbal situations or conversations to show that they understand the work that we're doing. From your GCSE health and social care course, you can then move on to lots of different level 3 courses, but it's ideally suited for going straight into level 3 qualification in health and social care. So if you're someone that wants to go into health and social care industry and you're looking at a caring career, then it's an absolute ideal course for you to take. Before we actually start the coursework in year 9, you get a little bit of an introduction to what we're going to do, and we do a gateway curriculum. And this sort of bridges the gap between what students know about health and social care and what they're then going to learn in the course itself. So this gives students lots of little mini projects and gets them used to what they're going to be expected to do during the course of the topic. Finally, if you do choose health and social care, you're giving yourself a really good opportunity to go into lots of different careers. Whether it is within health and social care itself, whether it's working in a nursery, whether it's working in a school, whether it's working for the NHS, whether it's working in social care like within hospices or care for older people. But it also gives you a good basis for going into lots of other careers such as police, education, armed forces, rehab, sports coaching, nutrition, and psychology. If you do have any questions, health and social care is normally taught by Miss Frobisher and I. So if you do have any questions, come and find us. If not, hopefully we'll see you at the taster sessions soon. Thanks for listening.